stay on with us, and we hope to make this available in the future. As we are all unfortunately aware, there has been a significant rise in hate, violence, and bias crimes directed against Asian and Pacific Islanders in America. Anti-Asian prejudice, bigotry, xenophobia, and racism are certainly not new in US history, but have worsened in recent times, especially during these extremely difficult pandemic, economic, and politically polarized period in our country. Our session today will help us begin to, one, gain a greater understanding of the diverse experiences of the AAPI community, second, become more aware of views and perspectives related to the increase in hate and violence, and three, explore how the AAPI community, working with others, can move forward in a safe, bold, and effective way. Our webinar format will include first an initial keynote presentation, followed by a 30-minute interactive roundtable conversation, and then a general question and answer period as our time permits. Before I introduce our three accomplished presenters, here are the logistical guidelines for the program. All attendees will be muted and off camera for the duration of the session. The chat feature can be used to pose questions or comments for the speakers. Please know, though, that our time is limited, but we'll try our best to get to as many questions as possible. Feel free also to utilize the reaction button in the participants section. We want this to be a safe, brave, and inclusive learning space. Please ensure that all communications and interactions are respectful and professional at all times. Please also share your contact information in the chat, especially your name and email, so we can add you to our constant contact list. So we're privileged to start off our discussion with Dr. Sue Wang, Medical Director of the Center for Asian Health at St. Barnabas Medical Center, which is part of the RWJ-Barnabas Health System. Dr. Wang is board certified in internal medicine and has an MPH degree. She directs a highly successful Chinese health initiative to meet the primary healthcare needs of the growing Chinese American population in northern New Jersey. She is nationally and internationally recognized leader in hepatitis B and C care and serves as the current president of the World Hepatitis Alliance, a global patient-led NGO. Dr. Wang will then be joined by two network colleagues for an interactive roundtable discussion. Jackie Lu Rea is president of Alexina Consulting and specializes in diversity, equity, and inclusion engagement and training. Ms. Lu Rea has worked extensively with a host of businesses and stakeholders across all industry sectors in both New Jersey and the tri-state region. She has been actively involved in leading community health, multicultural, disability, healthcare, banking, transportation, and military workforce development initiatives, to name just a few. Zenaida Steinhauer is a nurse and retired quality assurance specialist from the New Jersey State Department of Health. Ms. Steinhauer previously worked in the Division of Family Health Services, where she was a QA reviewer of birthing and pediatric hospitals on birth defects, responsible for surveillance of birth defects and special projects implementation, and a trainer and consultant on the birth defects and autism electronic reporting system, policies and procedures on birth defects. She also was one of the founders of our New Jersey statewide network for cultural competence. Each will provide additional background information about themselves during the discussion. We have all agreed to be addressed using our first names during this informal conversation. Jackie has also agreed to be our official timekeeper, so we'll raise her hand 2 minutes to the time to proceed to the next portion of the program. And she's waving to everyone. So I'm now pleased to turn over the program to Sue.
Great, thank you, Bob, and everybody else who's organized. Jackie, thank you so much for having me and for your meticulous planning. It's great to be here with everybody. It's interesting, I met Bob many years ago, just in working, as a physician who works with the Asian community, working on different cultural related issues with medical care. And so it's interesting where we are at this point in time. And as I was kind of processing my own experience, I realized, for a lot of us who've been doing this work in cultural competency or representing minorities, racism and minority, the challenges minorities face is not new, right? I've been studying this I have a degree in public health. I see it in my patients. I created this Center for Asian Health specifically to help decrease the barriers and be a bridge for the Asian community in terms of their the barriers they face getting healthcare. So whether it's language related or just cultural, or just having a hard time navigating our healthcare, our complicated healthcare system in the U.S. And even, hearing the stories of what they face. A lot of it, we never, as healthcare providers, never think that we could be a source of racism, but I do see it in our patients in terms of what they face. So on that level, this is not a unfamiliar thing. Having it strike, or occur within the Asian population is interesting. There's been a lot of data that's well known about the Black population, and I've definitely learned a lot about disparities in the Asian population as well. But when it hits me, my community, it has a very different feel. And we've been allies with the Black community for so long, to the point where it's interesting. I've had a number of friends come to me and say, I see all this buzz happening in the media about all the anti-Asian racism. These are my other Asian physician colleagues, and they say, but we don't feel that way. I don't think we've ever faced racism, and this is unfamiliar to us. And I'm happy to stand up for the Blacks, but I never thought of the Asians as somebody who needed to be stood up for. And I think some of it is nobody wants to feel like a victim, but some of it is that we really have brushed this under the rug so much that it's easier for us not to see it as an issue. And so the second part of this, which I want to talk about later, is just how I process this personally, as opposed to just professionally. So professionally, as a physician, we have heard so many stories of our patients, and a lot of what we do is really just representing the Asian community. And I want to just kind of read this post that I had shared on social media. In the midst of this, we've been vocal on social media. We've collected, we created collages of all the Asian, a number of Asian physicians and staff, donning their masks and their N95s, just because it's been such a shame that a lot of this racism has happened because of COVID, because of the ideas that, it's a Chinese flu virus or a Kung flu, that some of this terminology has really been very difficult has made it okay to make us scapegoats. And yet on the front line, how many healthcare workers are of Asian descent, right? And they go to work battling COVID virus, risking their lives. But you hear these stories as they're walking to the hospital, somebody spits on them. As they're coming back from work, having done an ICU shift, somebody assaults them. I mean, these stories are happening from friends of my friends in New York. And these are people who are taking care of people with COVID. And that's just a travesty and such an ironic thing. So I wrote this on social media, and I said, at the Center for Asian Health, we are grieved by the rise of attacks in Asians, and we see the hurt and the fear in our community. Every day we care for Asian patients and are privileged to be part of their journeys. Some are first generation and have adapted to a completely different language and culture. Some are second generation and the US is their only home. So when people tell them to go home, they feel like they've been betrayed because this is the only home that they know. We have learned so much from our patients, and they exemplify grit. I had a 90-year-old patient once who only spoke Chinese. She somehow navigated the bus system from Newark to the suburbs of Livingston and was so grateful she tried to thank me with a $20 bill. We fight for their health. We screen and manage and treat disease. We celebrate when they make strides. We also shed tears when they receive a diagnosis or lose a loved one. But we also witness bias and discrimination in their stories. Sometimes it happens in healthcare and they don't get the same care as others. And it is really hard when they tell us of verbal harassment, of being robbed, or being held up while making a food delivery. They often never report these incidents because they just want to move on, and they feel it won't make a difference. So on behalf of all of our patients and our community, we must speak out. Their stories must make a difference and lead to change if we are to embrace our diversity and heal as a country. And I just want to commend the organizers for doing this, because I think this is where the work happens. It's in these conversations that we have with each other, sharing stories, and this needs to be replicated all around professionally. And I think those of us who are Asian and have experienced things, I think as we process this, us sharing our stories is really important. And as I shared little snippets here and there, and even with friends of mine, we've started sharing with each other, and it's like we never ever talked about these things. We never talked about what it was like growing up and what we faced, because it doesn't come up, right? We don't live thinking about racism all the time, but it's coming up now, and I think it's very important for us to process this and bring it up to the forefront, because if we're going to make change, this is what's going to happen. So there's been so many rallies that have happened, vigils, and it's not something that Asians are comfortable doing. We generally don't do this kind of advocacy and protesting, but we need to. And that's part of the problem, is that we haven't been vocal. So I attended one of these in my neighborhood, and it was organized by some local people. There was a great turnout of the Asian community, but also the local leadership, our town, the superintendent, and a number of town leadership. So, and I wrote this piece afterwards, because when I approached, as we drove up to, and I saw all these people, I just started crying, and I wouldn't have expected that. It was just seeing this turnout of people, recognizing our struggles. And so, yeah, sorry. I was surprised at the surge of emotions I experienced when I saw the crowd that had gathered for the Stop Asian Hate rally and vigil in Berkeley Heights. It was a feeling that our struggles were given recognition, and we were uniting and moving forward. All the tears that had been suppressed over the years were given permission to flow. I love seeing our non-Asian allies. It means the world to us to have you at our side after feeling alone for so long. Collective presence is really powerful. It brings out the invisibility and the shadows of shame. It acknowledges the loss, the suffering, the pain, and the fear experienced by our community and in our individual journeys. It calls out the injustice, gives recognition to the hurt, and it demands action. I was so impressed by the young people who spoke. They were so eloquent, convicted, and impassioned. They shared their personal stories, including painful incidents. They cast their vision to not have to keep their head down or to be ashamed to be Asian American, and to just want to be treated with fairness and respected by their peers in school. At their age, I was embarrassed by being Asian. I hated when my parents spoke Chinese around my friends, and I tried to be as white as possible to fit in, and then often looked at disdain at my culture and anything attached to it. I regret that now, and it would break my heart if my kids did that. But I felt shame about my lunches that were unfamiliar to my peers and the foreign spelling of my name, and I buried any insults with shame. My kids say they don't feel this way. They have the benefit of having Americanized parents. They rest on the sacrifices of their grandparents who suffered much to immigrate from Taiwan, learn a new language, and make a life in this country. But yet what they haven't experienced is that even those people who have lived in America for generations, we are often still considered foreigners just by the way we look. And so we do owe it to our next generation to really make America a country for all. So I'll just end there, and thank you so much for having me.
So I think what's going to happen next is we're kind of going to think of this as a cafe conversation, where each of the members on the panel will pose some questions to each other that were shared, and then hopefully this will be a very organic dialogue. So I think, Sue, would you like to start that off and perhaps pose some questions to Zenaida and Jackie?
Sure. So our first question to each other is, what was your most notable experience? Hold on, I just got to open my screen all the way. Okay, what was your most notable experience growing up in America? Jackie and Zenaida, did one of you guys want to take that first?
Sure, I'll go first if that's okay, Zenaida. Sue, thank you so much for your opening. Thank you so much for your heart in this. And I'll have to apologize myself because I could see myself on the camera, and my forehead is, I think, permanently furrowed right now because this is a tough time and it is an emotional time. So growing up in America, I wasn't born here. So I was born on the island of Jamaica. I am Chinese by descent, but that kind of throws a lot of people off. But I came over here when I was 5, moved right into Manhattan. And one of the things I remember most about being young and growing up in America was walking into 4th grade in the suburbs of New York and just having all these eyes on me. And the great part about that was that they welcomed me. It was all white individuals who were my classmates up in Monroe, New York, and they all welcomed me. And it was pretty amazing that I didn't feel any different. And I was just blessed to be surrounded by some pretty incredible people. And it wasn't until high school that I remember being bullied for being Chinese, to the point where that scar will never, ever go away. And forever, I will hold that particular individual accountable. I mean, I would go out of my way not to walk down certain halls because of the mortification, the embarrassment that people actually allowed this kind of bullying in high school and didn't put a stop to it. But I have to say that I was blessed with a strong will, because the other thing I remember is my clothing. If there was an Asian decal or dragon, or I was buying it and I was wearing it, which was a dangerous thing for me because I had no idea what they said, but I was so proud to be Asian, to be Chinese, and just rock whatever it is that I could, whenever I could. So it's interesting that where the other place that I found that we were kind of made fun of was when we went to Chinatown, because although I didn't speak Chinese, my mom did, but she spoke the Hakka dialect, and my parents spoke Hakka, and that is not a common dialect here. And the store owners and other people kind of looked down on them because it's kind of known as a little bit of a country improper dialect. So yeah, it was mostly great growing up, but there were moments that will stay with me for the rest of my life that were not so great. So thank you so much, Sue.
As for me, thank you so much, everyone, for being here. And Sue, you really verbalized everything about, you know, being Asian and all of the different experiences you've had with your patients. So I thank you for that. It truly came from the heart. As for me, like Jackie, I didn't grow up in America either. I was born and raised in Iloilo City in the Philippines. However, I spent a small part of my early childhood here in the United States when my father came here on an exchange visitors program as a physician when I was 4 years of age. And I didn't really know what racial discrimination was at that time, because my experiences here, like Jackie, was also very positive. And growing up, I didn't know that I was a Filipino. I didn't know my race or my ethnicity. So we returned to the Philippines when I was 8, and I was enrolled in 3rd grade in a Catholic school. And it was actually there that I realized that I was different. I was treated differently because I spoke English as my primary language, and I didn't know how to speak our regional dialect, which is Hiligaynon or Ilonggo. And the kids would make fun of me. I was given preferential treatment in my school and in my social life, not only because my father was a physician, but also because of my skin color. And compared to other Filipinos, my siblings and I were lighter skinned because of my mother's Spanish heritage. We were classified as mestizos or mestizas. And I know that there is a certain group of people here in America that's also called American mestizos. And this is a combination of European and native Filipino descent. My great-grandfather was a merchant marine from Barcelona who came to the Philippines, married my great-grandmother, and settled there. So I spent the rest of my childhood and the part of my adult life in the Philippines, but I returned to the United States as a second-generation immigrant in my mid-30s. And coming back as an adult, I noticed the stark difference between how children were brought up in the Philippines and how children were reared here in the United States. There's not only an abundance of choices here, but also more freedom for children to make those choices. here you can ask your 5-year-old, do you want mac and cheese or peanut butter and jelly sandwich or chicken finger for dinner? Or do you want salmon and broccoli? In the Philippines, it would be, we're having rice and dried fish for dinner and that slimy vegetable you put in the soup, or sauteed bitter melon. So you don't get to choose what you eat. You eat what's on the table or you go hungry. Kids here are trained very early on in life to make these choices. They have the freedom to make their own career choices, the universities they go to, the student loans that they can take out. And many kids don't have that in the Philippines. And this is what, what was most stark, a very big difference in my life growing up. And coming back here, there are very limited career choices and much less resources to make things happen, or to fulfill your dreams in the Philippines. So I didn't have that freedom in the Philippines either. So my late father, blessed memories, made my career choice for me to ensure that I would be guaranteed a good job. And for one thing, he was right. So I thank my father for that. Otherwise, I wouldn't have known what kind of a diplomat I would have been, because that was where my thinking was at that time.
Great. I'll just share really quickly, because I did grow up in the US. I grew up in the deep South, so redneck Riviera. And so, Jackie, when you talk about your experience in New York, I think, wow, I wouldn't know how different it would have been growing up, but it's clear that this kind of bullying, happens everywhere, right? Even if you are in an Asian country, even Zenaida. So I think
Yes.
this is not going to go away, right? People as kids, right? There's always a sense of, I think what we're identifying, it's that otherness, right? There are always people who are going to feel other, different from you.
Right.
But these stories are really just highlighting how childhood traumas really last your whole life, right? And how
That
important
is-
it is the words, right? That verbal violence is something very heavy. And I think it's easy to brush under, but it stays with you. And so I grew up in Pensacola, Florida. My dad was a chemical engineer, and there were a number of companies down there: Monsanto, Westinghouse, and Champion. And so all the few Asians that did live there all usually came because their parents had jobs in that, or they were restaurant workers, which is what we see in New Jersey too, right? That bimodal distribution of education across our community. And so I grew up kind of thinking I was white, because that is what I saw. But I knew I was not white because of the comments I got. So a lot of the slanty eye comments, a lot of the, whatever things about your food or your name. And I think we just all get so used to it. We kind of like, I have, when I try to remember distinct incidents, like I have some memories of like standing in the lunch line and somebody making fun of me or things like that. But I think after a while, you really just kind of ignore it because you get so sick and tired of it. But it can happen anywhere. I remember being an adult and like traveling to Latin America, and I couldn't understand the Spanish, but I could definitely tell they were making fun of me, with the ching chong noises. And that's, global, unfortunately. And so I think this is, I think what's happening is this has dug up all these like old memories. But it's really helpful, I think, for us to realize, and I think for me as a parent to be able to share with my kids, right? Like these things, what they say to their friends and other kids can really have a lasting impact on them. But still, I don't think my childhood was terrible. I still had a great childhood. But it was, I don't think I'd want to go back there. Like, I don't know. I have mixed feelings. I like my kids are not feeling that because we live in a fairly diverse area. And so I feel like a lot of these efforts that are happening are in more urban areas. And so I am concerned about rural areas in America where there are Asians and there may not be as much diversity. So I think that's something we have to, be aware of too, right? And make sure these efforts span the country and not just urban areas.
That's true. And I just wanted to add to that. It was only recently that, I'm married to a Jewish person. And it was only recently that he said, somebody made a comment in his office and said, oh, I didn't know, because we had a picture in his office and of our wedding many years ago. And she said, oh, I didn't know that you were married to a person of color. So he never even knew that I was a person of color because we both never thought about that. And you know, and he came home one day and he said, I didn't know you were a person of color. And I said, oh, I am. And I said, am I a colored person? He said, no, that's completely different. A person of color is different from a colored person. Okay. So, you know, and another incident happened when, and that's when it actually brought up my own, you know, the colorism in this country. We talk about colorism and racism, and you can have, you know, that experience I had in the Philippines was because of my different color. I was, you know, a little different. I was treated a little differently, although it was preferential. But there was also a time when we went to Koreatown to have dinner. And so my husband, you know, when we entered this restaurant, it was packed, and he turned to me and he said, we're the only white people here. And I looked at him and I said, no, you're the only white person in this place. And so everybody else was Asian. So, you know, it brings to mind that, yes, every now and then we are reminded that, you know, that we are Asian, you know, although we are of, you know, of different colors, of different races, is that we can still, you know, have fun together and live together in a very, you know, nice way, and you know, cooperate with each other. So so that brings us to our second question, and I would ask this of Sue first. And the question is, as a member of the AAPI community, what do you see as the biggest challenge today?
So
Sue?
I think one of the things, because there's a number of conversations happening at the same time amongst on race amongst different groups, right? So obviously, you know, Black Lives Matter is so important, and there's been a long history and obviously continued horrifying things really happening, especially with the police. And I think what I've heard even amongst Asians is, oh, we don't have it so bad. Are these really real issues? Like these kind of, they just happen, you know, let's not make a big deal out of this. We kind of don't want all this attention. This attention might be backfiring on us. I've heard this from friends who are like, why are you, you know, why are you talking so much? Why are you saying so much about this? And I think one of the terms that I've heard, which I think is really important, and because I think in the end, we all need to have solidarity around these events, right? Solidarity against racism. We want to end racism for all. Is that we don't want to get into this trap of this great term, which is called oppression Olympics, right? Who has it worse, or who's been through more, and is what we're going through something real or not? I mean, it's clearly something real. It's different. Every group will go through different kind of oppression. And so I think that, you know, instead of competing amongst groups about what racism is, we really need to come together as people of color to rally again to end all racism. And so I think that's one step that we're still struggling with within the Asian community. Okay, thanks.
Okay, thank you. And Jackie, what do you think is or what do you see as the biggest challenge today?
So the biggest challenge, and yeah, one of the things, and I have to agree with Sue, is being too focused on one particular group, including ourselves, because we all have issues that we're trying to deal with. You know, it's not even just about color of skin, it's LGBTQ, it's all of these things that cause hardship and pain in a lot of different populations. For me, the most difficult thing right now is, what am I going to do? Do I start making noise when in the past I never would have before? Do I just walk away from something, or do I pretend that I don't hear, or that I don't acknowledge what is happening to my family who lives, you know, in larger cities? And it seems that that's where a lot of these verbal attacks and physical attacks are happening. I mean, it even comes down to the point of, do I post something on my Facebook page which could be deemed even slightly political or controversial. And unfortunately, my challenge is that I'm asking myself that question more times during the course of the day than I care to admit, because there is a very fine line, I think, between making some noise and doing the right thing for yourself and your community as a whole, but also taking a very big risk of backlash and criticism, of which I'm not used to either of them. And so I find that in a lot of cases, I avoid, in some cases, doing the right thing. So that is my biggest challenge right now. What do I tell myself to do? And what do I tell my immediate family to do? And what do I get involved in as a community member? So, Zenaida, what about you?
Well, for me, I think it would be, it's a very basic need of just self-expression. You know, Asians are mostly quiet people. We keep to ourselves, you know, especially if we live in our own communities where people don't speak English. You know, we have pockets of these communities, like in Jersey City, you have a very big Filipino community there. Or in New York, where you have a very big, you know, Chinese community, where most people don't even go out of their communities because they wouldn't know how to interact with each other or with people outside of their own, you know, community, because they don't speak English. They're afraid to do that. And most of the time, you know, for people who don't speak English, they don't show their emotions. They don't want to rock the boat. And it may be a cultural trait, but the way I was brought up, you know, we didn't talk back to our parents or our elders. We had to show them respect even when we thought they were wrong. And most Asian people are you know, too polite to expressively tell you if you're making them uncomfortable. So a lot of times it would be if somebody says something you know, uncomfortable to you, or if it's something that you don't agree with, a lot of times you just sit there. The Asians would just sit there in restrained silence. And it's bad to correct an older person or a person of power or a person of high stature, especially in the Philippines, because it would make them lose face. And also it would be an embarrassment to you. So a lot of times most Filipinos would internalize these feelings because they have these fatalistic beliefs, you know, that events, it's inevitable. No matter what I do, I just have to accept it. And it's almost like que sera, sera. Whatever happens, happens. You know, it was bound to happen. And I think that's, you know, to me, one of the biggest challenges is just to express yourselves and to say what you're truly feeling. You need to lift your voices. We need to lift our voices to be heard. And it's the only time that, you know, it's an important step to do healing or to make healing happen with us if we're hurt.
Zenaida, thank you so very much. Before I ask my question of the two of you, I just want to say, first of all, thank you to the network for having us for this very important discussion. And I want to thank the 45 people that have joined us today. If I could remind everyone, if you have questions that you would like asked, can't guarantee that we're going to get to all the questions, but there is going to be a section. So if you could just put it in the chat, and also to put your contact information, particularly your email address and your name, so we could add you to the constant contact list for the network. So Zenaida, here's my question to you. What do we need to do to move forward in a safe, bold, and effective way?
For me, I think it's education, education, education. My father put a very high premium on education. Children should be taught early on, not only about how great America is, but also the history of Asian culture and the struggles and contributions that Asians have made. in making this country a great place. We can't raise children on prejudice, so they have to be taught, to be, because we are living in a very diverse society, we have to teach them the importance of respecting each other and everybody's culture. We need to augment these trainings with and education with cultural competency training. If something goes wrong, we need bystander intervention. If there's somebody being hurt, out in the street, for the police, there has to be a crisis escalation. And I think that there's really no safety in silence. So we need to stand up, we need to stand together and speak out against any injustice that we're seeing, because when people don't stand up immediately, other people could be emboldened to commit acts of violence or other crimes. So we need to speak up, we need to stand up, to speak out, and to protect the vulnerable, which was the other day at the Holocaust Remembrance Service, one of the common threads that we had.
Zenaida, thank you so much. Sue, what about you? What do we need to move forward? What do we need to do to move forward?
So I think what Zenaida says about education is really important. And I think, as we've been having discussions like this at different places, I think a lot of us are reflecting that as kids, we grew up never learning about Asian American history. And I can say as a child that, it's definitely not covered in our kids' history books. And that's something that's important, especially, I've learned so much just from this as people go back and talk about how the Chinese have been a part of the creation of America, of the railroads, and how we've been in America for so long, and most people are not aware of that. So I think as we're talking about, raising this new generation with a lot more awareness to diversity and appreciation, that is something, as you're saying, Zenaida, how do we get this into the textbooks, right, for our kids? And I think educating ourselves as adults, having conversations like this is the work. And I think us each in our own circles, creating spaces like this for dialogue across, very different groups. And I love how diverse this audience is. What you've created with this network is really important. And I think we need networks like this in all professions. And what I've seen on social media, which is so cool, is, obviously I live within the healthcare field. And so I see doctors and nurses and people chiming up within our sector, but then I've seen reporters doing this. I've seen the Hollywood actors like getting together and really like creating cool things together, videos and speaking out. And then you see artists have been coming together, creating some really beautiful pieces that convey the message so powerfully. And so it's just really neat to see how in every sector, whatever kind of work you do, you can make an impact. And so that's, a challenge I really make for everybody. And within clinicians, I was on a panel not long ago that was Asian Americans and Black physicians coming together and talking about their own experiences of racism and bias. And we came to this awareness that would have been difficult to come to this awareness, like just in a academic kind of lecture, that we all do this. And there's been more and more training on implicit bias, but we realize like, hey, we treat patients differently sometimes. Like somebody who doesn't speak English well, sometimes we don't discuss all the options with them. There's this like horrible realization that thought that like, oh, they may not be as intelligent or they won't understand as much, which is exactly the opposite, because somebody who's come to this country and has learned English and has their language, they're actually, probably more intelligent for being able to, balance two languages. And so we all have to do a lot of deep digging, I think, with, in our own implicit biases. And Asians, we are not racism free either. We have a long history of racism, even amongst different Asian groups, right? So I think there's a lot of reckoning that needs to happen. And even across generations, Asians see this whole issue differently. So I think it's a good chance for everybody to really kind of dig deep and process our own beliefs. Thanks.
Thank you so much, Sue. So for me, I think that it is very important that we take the time to, one, feel empathy for everyone around us who is going through this, not only just Asian Americans, but everyone of color, everyone who is different and who has experienced some kind of bias, some kind of hate, some kind of bullying. Let's just start there, because if we're talking about children, if we don't start with the children, I think we're going to be raising a generation of unempathetic, unsympathetic people. For me, I think that we need to get ourselves a little uncomfortable with how we, and I'm going to generalize here, but I'm really speaking about myself, to be a little uncomfortable as far as what actions am I going to take to address these bad things that are happening to our community right now. And so, we use the term upstand. I want to be an upstander, but I just don't want to be an upstander just for Asian Americans. I want to be an upstander for my fellow human beings. So I think to go forward in a brave and bold and meaningful way, not only to put myself more out there than I usually would, but I'm usually one to kind of walk away if I see something not going the way it should be, not right. If someone's being bullied or made fun of, myself included, that we need to address that. We need to, as a community, start where we have control, because let's face it, we're not going to change the country, the world overnight. But man, I think I could definitely change myself. I could change maybe what's happening in my family and in my immediate circle of friends and colleagues. I can change that, or I can at least try to change that. I also think that we have to be very mindful that when we say go forward in a safe way, that is exactly what I mean, is don't take chances that are unnecessary. The reality is right now is that folks are being verbally attacked, spit on, sprayed, kicked, punched, all those things. If you know someone, especially an elderly person who needs to go to the store, walk with them, go with them, take them. Just these things that we can do to protect ourselves. And this is, again, as a community, to just be mindful, to not put ourselves in positions of potential harm. Now, I'm not saying that we need to hole up even more than we have already during the coronavirus. I am saying, though, just be mindful. Yeah, I recall there was at one of the protests, one of the protesters was approached by someone who wanted her sign. And instead of giving up her sign, she fought with him, and she ended up being very hurt. And so to me, it's like if someone wants to steal your car, give them the car. It's replaceable. Give them the sign, but try to avoid putting yourself in harm's way. I think that is one of the most important things to do. So yeah, let's be uncomfortable, let's be curious, but let's be careful, and let us upstand for all our fellow human beings out there and ourselves. So right now, what I'm going to do is I am cruising the chat here for questions.
And let me just start, while Jackie, while you're doing that, I first want to thank everybody for their courageous comments and the sharing. It kind of reminds me of a quote from Austin Bradford Hill, a researcher, who once said that health statistics are people with the tears wiped away. And I think these stories are such an important starting point. And as a white Jewish male listening to this, I'm quiet because there's so much I need to learn. Even though I may have experienced different forms of anti-Semitism and other forms of bias, and many of us on the webinar, I think, may also have, we need to step back and hear those types of stories. While you're looking, there was a question that we were debating what other kinds of questions we might ask. And so I'd like to offer the following one, and then we'll move into the group, which is, how does the media help or hinder addressing anti-Asian racism? And I wonder what thoughts people may have.
Hmm.
Sue, did you want to take that?
Yeah, I mean, I'll start. So I think it's obviously important to bring these things to light. These incidents have been happening obviously for a very, very long time, even pre-COVID, and even during COVID, we had hints that it was happening, but I feel like the reporting was not complete. People were not reporting it to law enforcement. And so
Mhm.
when we talk about collective experience, if just the three of us have had these incredible, traumatic events, just think about collectively how much trauma as a community we have all endured, right?
Right.
And so I think it's very important for us to bring that to light. And even talking to amongst my friends, we've all buried these things, but as we bring it up, we realize, wow, we've all been through some of these same issues. So it's very important. What I also tell people is this is not going to last forever. The attention span of media is very short. So it'll be the next thing soon. So I think we have to grab this opportunity to process this as a community as we can, because next week it'll be somebody else, right? And we just stand with all those other groups. But I do think it is a two-sided sword in that it does create fear where you wouldn't have otherwise thought about these things because you didn't know about something happening on the streets of Manhattan because you live in Nebraska, but now you've seen it and you've seen these horrible videos of people being assaulted, right, violently. That gets in your head, right? And so people start being fearful when they may not have otherwise been fearful. And so I think that is definitely taking a mental health toll on a lot of people, including seniors. I think this is kind of one of those necessary evils of what happens when you report, but I think these horrors need to be reported. Similar, Bob, as you're mentioning, like the Holocaust needs to be reported, right? We need to know these terrible things have happened so they don't ever happen again. And I think that's the way to kind of see it. Even though, potentially could create fear that wouldn't have otherwise been there, but we need to, prevent these things from happening.
That's right.
Zenaida, do you want to speak to it?
Well, it looks like Sue said everything, that encompasses everything that we all have in mind what media should be doing. But, we can't have a democracy without a free press. So we also need to inform media that, that all of these things are happening so that whatever issues or crisis is happening within the Asian community is that it is brought forth and it needs to be reported as facts, and not to espouse whatever conspiracy theories there are regarding Asians and the Pacific Islander community. But it is good to have the role of media would be to clarify issues and bring them to the forefront so that more people are aware of them. Like Sue said, it gives voice to our legitimate concerns. And like she said, if it's not reported, then who would know like what happened to this Filipino woman who was attacked in New York? She sustained injuries, had a broken hip. Two guards were at this hotel and they saw it. It's like, what did they do? They could have done something to prevent this, but all they did was they closed the door and not helped her. They didn't say anything to the perpetrator. It was like just nothing happened. They didn't want to be a part of it. So we have to do something about it. We can't just stand there and not do anything. We really need to, again, be to stand up and to speak out, and we need to protect the vulnerable. That's my my take on that.
Zenaida, you bring up probably one of the most painful visuals I have over the last year. And where I disagree with you is that you said nothing happened. Actually, something
they did, yeah, but
very
at the
negative
very moment.
No.
Right.
I'm talking that moment. They actually closed the door.
Oh, yes.
Pretended not to see anything,
Pretended
which to me is that what kind of human being does that to another human being?
Right.
Multiple males, based on what we could have seen. So in that way, I feel that the media was quite helpful because there's a lot to be said for public shaming.
Mm-hmm.
But also, then what? Then the employees need to be addressed. They need to be fired. They need to see some trouble. They need to see consequences and feel consequences for not being good fellow human beings. So it's interesting because Nawaz has asked if anyone from the police department is on our call today. And certainly I would love to say, yes, they are. Certainly I know I have connections within the police department, though not a police officer myself. However, this conversation is not over for us. We definitely will continue to be addressing these things. But yeah, police are responsible for making sure that things are reported and acted upon. But we as individuals are responsible for making sure the police follow through on those things and that we follow through with those things with the police, right? So we can't, there's no finger pointing here. We are all responsible for our own actions. So let's take it upon ourselves to make sure the right thing gets done,
I
right?
just wanted to bring up, I think there's, with all of these incidents, there's always a remark about like, oh, well, what did the people around them do, right? What did the bystanders do, right? And there's
Right.
always a sense of disappointment, like nobody did anything. And so I had posted in the chat this link to this organization, iHollaback, that has started these free bystander trainings online. And they have great material. I think, the question is, what would each of us have done, right? Everybody, if you were in that situation, would you have stopped, the perpetrator? I'm sure it was very scary. And so they have some very simple things that I think are, one of the first steps they say is just distract, right? Instead of like, going head on with the perpetrator, but like, make a loud ruckus, drop your keys, spill your coffee, something that just like takes the attention from them, potentially distracts them from what they're doing, ask for help, just gives people these very practical things to do. That way, when you're in that situation, you don't become somebody who becomes the silent person. I think none of us want to be in that situation, but it's important to be prepared. And I think in terms of the police, I mean, I've heard horrible stories of like police also like harassing Asians. And, obviously we need to do more within the police force in terms of diversity training. I know in New York, they're creating a task force with Asians. But I think we also invite them to these things, as somebody in the chat mentioned. And I know at the rally I was at, the police were invited and they spoke. And I think having them really engaged and feel like they're representing and protecting our community is really important. So I agree, Jackie, we got to continue this conversation with them as well.
Absolutely. So my friend Sharon is on the line and she has a question. Do children learn the language to intimidate others who are different to them? Or do they imitate what others around them, perhaps adults who may speak about these situations in front of their children? Great question. So Sue, you have youngins, so tell us, what's your take on this question?
Yeah, I think it's a mix. I think, some of it is, human nature in terms of, this is sometimes what we do when we don't understand people that are different from us. But then secondly, yeah, I do think some of this is what they see modeled in their families and how they may see their parents or other leaders, the other adult figures referring to people. And I think it's really important that we have these conversations amongst adults, amongst kids. I feel like, as kids, they do, at least at our school, they do quite a bit of character education and training in terms of acceptance and all that. And I think so they all know, I think on the academic side, this is the right thing to do, but to see it modified in action is something else. And so I have to share this one incident actually that happened not long ago. And we were at a park somewhere in Pennsylvania, and there was a group of adults with some kids, and it was like two moms that looked like they were taking a group of kids around at Valley Forge. And as they were getting into the car, I heard one of the kids say, it was a mostly white group with two African-American kids in there. And I heard one of the kids say, oh, the white people go in first, the black people will have to wait. And I was like, oh my God. And the two moms said nothing. And I was like, of course, later I'm like, I should have said something, but I was like, this is how it starts, right? Nobody stands up for those two kids. And I felt so terrible for them because their parents probably let them go on this trip thinking the adults were going to protect them. And we need to raise kids who would speak out, right? And definitely adults too, to protect the next generation.
Thank you, Sue. Everyone, it is 11:55 right now, and I do know that we have some questions in the chat that unfortunately we're not going to be able to get to. But what I'm going to ask our participants today is if you would be so kind as to share your contact information with us, if you would like for the speakers to address your questions after the call. If that is good with you, please indicate so in the chat. But I just have to say that I personally have learned so much. I have healed quite a bit with this conversation. And I just want to thank my fellow panelists for engaging with us, with the audience. And I want to thank the network for having us and having this important discussion. So Bob, I'm going to send it back to you. It is 11:56.
Right. So again, I also want to express my thanks to everyone for this wonderful and important conversation. I did want to very quickly address one question that came up about the person who's doing residency training in a rural area in Pennsylvania, how to care for folks from AAPI backgrounds. And I'll say the New England Journal of Medicine just published an excellent article on March 21st called Combating Anti-Asian Sentiment, a Practical Guide for Clinicians, where they talk about how to create a safe space in outpatient settings, inpatient settings for staff while taking histories, physical exams, and available resources. And I'm sure, unfortunately, there are several of my psychiatry and mental health and social health colleagues on here. There are probably many other resources available that could be shared. So I think this is, as I said, a beginning discussion. I think that for me, one of the things I would like to leave with was a quote from Paul Tillich, the theologian, who said, "The fatal pedagogical error is to throw answers like stones at the heads of those who have not yet asked the questions." And I think part of what's going on is how do we raise awareness about different questions? For example, how can we avoid stereotyping, stigmatization, victimization, and blaming of communities and re-traumatization? How do we work with people from the different generations, whether they are traditionalists and baby boomers and Gen X and Gen Y and Gen Z? In fact, we're hoping to have a webinar on that subject in June in looking at this issue. How can we address anti-Asian racism going beyond what some have called the black-white binary and ignoring the experiences and history of other communities of color and how these different factors intersect with each other, what people call the intersectionality of different isms? And then how do we build trust, bridges, and alliances and build into community-based efforts, policies, and resources and multi-sector actions that are now taking place? And the good news is that that latter is going to be, I think, part of the focus of our next webinar on May 18th, which is currently titled Exploring Policy Solutions to Address Anti-Asian Racism. So part of this is, what do communities do from within? What do they do with others? But how do we deal with power and privilege as it plays out in different systems? I know there's a deep question about how does this occur in a white supremacy, white dominant, if you will, culture and society. And I think that's a very important thing that we all need to talk further about. So I would just close to invite people, if there are any take-home messages that you would like to leave with our audience today.
Sue, do you want to go first?
Sure. So I just want to say, I think what's happening now is just really exemplifies how important it is to create networks like you've created here. Because we never know what issues will come up. And when you have a group of people who are, willing to learn about people different from them, that's where we really make some progress. And so, I just commend you for this network. And I hope that, we can scale up what you're doing basically here and continue these conversations. And I just think, like I was saying, the dialogue, the talking, this is the work, that needs to be happen in order for us to fight racism. So thank you, everybody.
Zenaida?
I think that take home thing for me would be, creating a safe space for everybody, or especially for staff if you're in an institution, And if somebody in your staff experiences some kind of discrimination or abuse or violence, is that you need to offer institutional support, for that staff who has been affected by the discrimination. And and don't just be a person. If something is happening, don't just stand there and be silent. You really need to do something about it, and to make that whole situation more, you have to make it tolerable for somebody who's um, experiencing some kind of injustice. You just don't be a bystander there. You have to do some kind of intervention, like bystander intervention, whatever it is, whatever it may be, to distract that person from creating more harm, to that person.
Thanks, Anita. So for me, my final take-home message would be this: be empathetic. And the worst thing that we could do right now is assume that we know what's going on in the minds of other people just because of their skin color or their lifestyle or whatever that may be. Be cautiously and respectfully curious about fellow human beings, your community, your families, and give them that safe space to express themselves so that you can learn about them and learn and ask how best they want to deal with certain situations, and not force anything on them that you believe strongly. That's okay. But people have different mindsets and different life experiences that I think need to be respected, acknowledged, and acted upon. So thanks, Bob.
Thank you. So we're at 12 noon. For those who would like to stay on for a more informal discussion, which is not going to be recorded, we invite you to do so. And I'll just put in a plug. The network is having its 8th annual conference, which is entitled Building Bridges, Breaking Barriers, and Cultivating Cultural Competency with the Diverse Deaf and Hard of Hearing Community. Again, a part of National Minority Health Month. And we're working with SPAN, the Statewide Parent Advocacy Network, in this effort. And that's taking place on April 26th through 27th. So we would invite you to come to that as well, and also future sessions devoted to these topics. So my thanks again to the participants, the attendees. Very important. Stay safe and well.
Thank you.
Thank you so much.
So we're going to